This is a podcast where real doctors discuss fake medical emergencies. That means that unless you've been bitten by a radioactive spider or sprained your ankle on the holodeck, this podcast is not medical advice. If you need medical advice or medical care, please contact your doctor. And while you're in the waiting room, please follow us on Facebook, Instagram, and Twitter at HiEverybodyMD.
Hi everybody, I'm Jackson Vane.
I'm Johnny Kolasinski. You might remember me from such podcasts as My 14th Favorite Murder, a look at failed serial killers in American history. This is Hi Everybody, a bad medicine podcast. Every week we look at what Hollywood gets right and wrong about medicine and how the body works.
And it is the first week of Hortober.
And it is the first week of Spookytober.
Nope, hashtag Hortober.
Where we're going to be looking at horror movies, scary movies, all sorts of fun stuff.
Hashtag Hortober.
Two excellent guests with us today. Many of you remember Greg Winter from, 5 episodes? 4 episodes?
It's like half of the episodes we've done.
Hi, everybody.
Yeah. And also Dr. Courtney Nicholas, who is joining us for the first time.
Did I not get a doctor?
I don't think you did.
I don't think I did.
A doctor.
Wait, you're a doctor? What?
That's all right. That's fine. I still like you, John.
We have Dr. Greg Winter and Dr. Courtney Nicholas and Dr. Jackson Vane and Johnny.
Yep, that sounds about right to me.
Mr. Johnny.
Mr. Johnny,
Mr.
Johnny Kolasinski.
Correct.
We're going to be talking about Human Centipede this week.
I'm sorry, it's the Human Centipede, first sequence from 2009, a movie that was billed as 100% medically accurate on its movie poster.
Yeah.
Was it really the first sequence on when it came out?
It is actually first sequence because Tom Six was very ambitious and knew that he was going to make a lot more of these movies.
He was going to make more than one.
So he actually did call it the first sequence.
So unlike George Lucas, who inserted episode 4 right before Empire Strikes Back comes out, he knew what he was doing here.
Yeah, I mean the whole
he wrote all three of the
movies,
Human Centipedes at once,
the
unlike
triptych.
George Lucas.
And do you guys know how he came up with the idea? Tom Six, the director of this movie.
I kind of don't want to know.
Oh, you kind of do.
All right, how did
Because he thought of this as a great way to punish pedophiles and whatnot, and he said if we sew them from mouth to anus over and over again, that would deter them from ever offending children ever again, which is hard if you're connected to a human centipede.
Alternatively, you could just make them watch Human Centipede.
Yeah. We all watched this right before we did this podcast, and there are notes aplenty.
There are notes aplenty. Check our Instagram, Hi Everybody MD, for that. This movie was billed as 100% medically accurate. Doctors.
There's a thing about billing is you can kind of say whatever you want.
Yeah.
Oh, so that's accurate.
Yeah.
You can say whatever you want in medical billing.
Oh, I took out some earwax. That costs definitely more than intubating someone, which is actually true.
That's weird.
and
Well,
there's a thing
cerumen
about-
impaction is a big deal.
Oh, it is. Way more important than breathing.
There's a thing about saying 100% too. I feel like it's a challenge. Nothing's 100%.
Would you say they met the challenge?
I would say they did a lot of things accurately, but they also did a lot of things for artistic license.
Yes.
And so that people could breathe comfortably while attached to someone else's butt.
There's going to be a lot of discussion about being attached to someone's butt today, I think.
So let's talk about some of the... We're going to try our best to keep this PG-13. But guys, we're talking about Human Centipede, and it's a movie where people get sewn to their face to butt.
Yes.
So...
Face to butt is an FTB?
So...
More like MTV, right?
It is MTB.
I want to talk about some of the
my
things
MTV.
that I think that were...
This is going to go off the rails so badly.
No,
Tell your
it's
friends.
not.
Tell your friends. to listen to this.
I want to talk about...
on board with this.
Yes.
100% because that's a high
It's
bar.
100%.
That is a very high bar.
It's a challenge.
I want to talk about some of the things that I think they did get right. Do people have anuses?
Yes.
Yes.
All right.
That is a thing.
That is a thing.
100%.
100% medically
Actually,
accurate.
not 100%.
Wait, can we just go back to what does Courtney do as her specialty?
So I'm a neonatologist.
Uh-huh.
I take care of babies in the ICU, and truth be told, some people are born without anuses.
I know that as a fact.
Yes.
But are they people?
Yes. All children are people. My patients are people, but it is surgically corrected. And so I would give it a 98% have anus.
since I don't deal with
99.
this, when they don't have an anus, I mean, is it like a blind?
I
Intestines are there, and then it's just like a big bag.
I have a friend who might be a listener to the show, who was born.
Not after I called him not a person.
Yeah, who used to be a listener to the show until Greg, who had that,
Yeah, so the
birth
intestines
defect.
can go down. They can actually go all the way to a blind pouch at the anus, or they can stop a little bit higher. From the outside, sometimes it actually looks quite normal, and you have to really check.
That was one of my first tests in my NICU rotation was, what's wrong with this kid? And I just saw a dimple. And they said, you didn't look close enough.
Yep.
And yeah, no anus,
So
just a dimple.
I attend many deliveries in my job, and I always used to teach the residents, you do not want to be the doctor to miss the imperforate anus.
Yeah, it's
So
it's
you
poor
check-
form.
Babies are born, and you check their butts.
So like five fingers, 10 fingers, 10 toes,
and a butthole.
and a butthole.
You do not go home if you didn't poop in the first 24 hours of life
48,
either.
yep.
So you gotta poop before you go home. But it is a good segue talking about anuses and not pooping in the first 24 hours of life to go home.
No,
Dr.
wait.
Heiter actually said I think he was inspired a little bit by the first scene where he saw some guy pooping in the woods, and then it transitioned to his 3-headed or 3-part dog.
Yeah.
And that's kind of what set up the whole movie from there on out.
I mean, I think that's what he tells himself so
Mm-hmm.
he can sleep at night. He clearly had some ideas of doing this for a long time.
Yeah.
He was not inspired by a man pooping in the woods.
No, I mean, if you have never watched this movie before, which I assume most of you guys haven't, Dr. Heiter is a world-renowned separator of Siamese twins, but he was tired of destroying and wanted to create.
Yeah.
That's
And I mean, just look at the art in his living room.
Yeah.
Everything is Siamese twins, as
Yeah.
fetuses, and
I mean, I sort of he's got some motivation. If you're a surgeon like that and you're separating conjoined twins, a lot of times one of them is not going to make it. You're making a decision that one of these kids is going to die.
Yeah.
I mean, he just wants to create something.
And
I
he
get
does.
it. I understand. He's going about it wrong. It's not a healthy choice. But I get his mental process.
as a person who's certifiably insane and likes to create things, start a damn podcast.
Yeah. But, he did get a lot of fodder to create when the 2 American tourists did show up to his house.
It's true. That
I mean, the greatest question someone can ask you while you're showing up to their door is, are you alone?
Yeah, followed by
Yeah.
are you related?
Yes.
so medicine aside, this is just perfect thriller setup.
As a public service announcement, if you're knocking on someone's door for help in the middle of the night, and the first thing they ask is, "Are you alone?"
You
Find
run.
a different house.
Yeah.
Run.
Yeah,
Just run.
this is the least creepy looking exterior.
It's true. It was that was a friendly looking house.
It
Yeah,
is.
but
looks
wait
like
till
the Golden
guy
Girls'
opens
house.
The door.
Yeah, and sometimes you gotta wait till the guy like, oh
Yeah.
no, not
Oh,
this
no,
house.
no. I'm going to go next door now. Thank
I
you.
needed some brown sugar.
Also-
and it looks like you're busy.
And I would say also, if the guy offers you a glass of water, probably not going to take
You're
it.
good. You're not thirsty.
No.
I will forever be watching someone's hands after they give me a glass of water at their house.
You mean if they're violently shaking it in front of you? you
No.
don't wanna
If when I
drink it?
take a sip, they squeeze the couch in ecstasy. That's if they're excited that I took a sip of water, I'm leaving.
Trouble.
I just like my couch.
Yeah.
Yeah, mine's pretty.
He really liked his couch, though. And he even admitted that it was the quote-unquote, these were his words, the rape drug. How did you feel about how they sedated the girl to get her down into the patient bay area? I got stabbed.
I mean, that's sort of weird because
Yeah.
he did dramatic injection, which is par for the course in anything Hollywood.
The wind up and
let's-
the inject.
Right. Let's wind up a little bit. Also, let's put it in the back of her neck, which is just very cringy.
Yeah.
The reason that that's cringy is because it would probably hit the spine, and contrary to popular belief, you don't want to inject things into bone unless you got the drill from last
I think it's
week's
cringy
episode.
for a more visual. Like nobody likes stuff going into their neck.
Oh,
I
okay.
mean-
So like cringe horror cringy.
Yes.
Okay.
Yes.
Hashtag Hortober.
Cringy from a medical standpoint because why would you do that? They have if you're gonna go in the neck, you go at least into the jugular, which is you can see that it's very easy. Wouldn't want to go into the pumpy one, the carotid, because that one would be spurty and gross and cause a lot of mess. This guy's obviously very clean. He doesn't want to go into an artery.
No.
It's just you wouldn't inject someone in the back of the neck, all things considered.
Yeah.
Did he say? Did that one? Did we know what he was drawing up in there or no?
Which one? With the
He
injected
injected her in the back.
No, it was just
didn't
another
say it.
drug to make
Yeah.
her go night night and made her go real sleepy. But then I think it's very interesting that they all woke up in their own gowns, but to the sound of beeping and hissing, it almost sounded like they were on ventilators. But no one was on any kind of support at all.
And
It was your idea of what should a hospital sound like.
Yes.
I like that that's where their head's at. Like,
Yeah.
but he definitely there aren't any monitors going, so you can at least you don't see any. It's fine.
Yeah.
Or at least they're not attached to anything, so it doesn't feel wrong that there's no cords and stuff hanging out of them. But the sound is a little bit weird.
Yeah.
But if you're in like an ER or something, that sound is all over the place.
I'm not gonna. Well,
As far as monitors go, I
depends.
don't know that he's
You-
worried about their livelihood.
I don't hear hissing and ventilators all the time
Also,
in the ER.
this is just one small
Yeah.
window into this man's life. There are some other rooms down in that basement. You don't know what's in those.
Yeah.
Yeah.
rooms.
But
He
I
could
did
have-
not-
He could have already made conjoined twins.
don't
Human
know.
butterfly.
Bird, rat pigeon.
Classic
Classic Simpsons reference right there. And then when they kind of drew back to Mr. Poop in the Woods, they said he didn't match.
He didn't match in size.
Was it the size
I
or was it
think it was
tissue?
size.
No,
he
no,
said-
Courtney.
he says-
Hey, Dr. Courtney, you think that it was about
was
size?
tissue?
Yes,
He
even
specifically
says
said
tissue.
Oh, I missed that part.
Well, the size thing makes sense. That was my
I
thought
thought
too
the girls
until
were
they
gonna
said
try to, like,
tissue.
Float. Oh, I didn't hear tissue at all.
I mean, it would be poor form for the
Right.
middle centipede's legs not to like touch
not
the
be able
ground.
to touch the ground.
But I
just
also
roll.
think that's exactly the type of guy that this guy
The
is.
last thing you want in your middle human centipede is somebody lazy.
Is a non-ground
You
toucher
need a
or
workhorse.
someone.
Just
Right.
eating poop all the time and not contributing to the movement of the centipede. But they did find well, they did kill him first.
They killed him.
Mm-hmm.
No.
And they injected something into him. Like, any guesses or what you think would be it?
Potassium?
Probably potassium. That's what they use for
Horses?
lethal injections and for lots of
Probably
things.
horses.
So
Alcohol.
they do kill off the first guy, and then they bring in the second guy, which
Who
is
obviously a tissue match.
yes, and that is the most.
That's when you find out that he is matching tissue.
yeah, jewelry about too, and I've seen
I have
a lot
not
of
seen
that.
that.
It's on Etsy. Just look up human centipede jewelry, and they'll show up. Courtney's probably doing that right now, but
Jackson's birthday.
no, please do not buy me a pendant of.
So buy you multiple pendants?
Yes,
Three.
I said
want
don't
a
buy me
pendant.
one,
I want
buy
a
me
pin.
multiple.
Don't buy one.
But let's go
You
through
can
the
buy
surgery
two for
step by
twice.
step. So, like, initially he says we're going to cut the patellar ligament, and then we're going to remove the canines from the jaw. Like, what is the whole point of that?
Isn't it just to keep you
I mean,
from biting
so you
somebody's
don't
butt?
bite- Somebody's
I was
ass.
paying enough attention to answer this, and I sort of don't want to answer it to indicate I was paying that much attention because he
But that's-
explained it.
That's kind of why we're having this podcast.
Yeah.
So please do.
Okay, well, he cut the patellar ligament so they would not be able to extend their knees anymore.
So they couldn't
Right.
stand.
So that way they would have to be on their hands and knees crawling around. It's weird because if one of them stood up, it would be no time.
Mm-hmm.
I also want to see that movie.
But the teeth.
But we're getting there. I'm getting there in a roundabout way.
The
You did it.
He's got a plan.
So he's gonna connect them. He's gonna connect their alimentary canals. That's just like the tube that starts at your mouth and goes out of your anus. It's the alimentary canal. And basically, your body is a closed system. Nothing from outside is supposed to get in your body. And that, although it is a very basic drawing, it's kind of accurate. Everything is sealed off except for the tube that goes through your body.
But also, I know you're saying it's a tube inside your body, but technically that
It
tube
is-
is outside your body.
Jackson, well played. Thank you.
It is
If-
technically
it
a tube
is.
outside
It is
your
not.
body.
It's not even technically. Like no, it is outside of your
It's like
body.
on the inside fold of your body.
Right.
Gotcha.
If you look up about human development, you'll see that like that is a thing that's outside of your body. Kind of like I don't know. There's no other way to explain
The
it.
food you eat is outside your body.
That is
Clear
perfect.
as mud.
Yeah.
Perfect way to say it.
Yep.
And your body does a whole bunch of stuff to that food so that it can absorb it and then send nutrients to where it needs to and send waste to where it needs to. But sort of in theory, if you hooked up those tubes from person to person, then they could all sort of absorb the nutrients that's going on as the food gets digested. except for each person has its own complete system, so it wouldn't quite work as well as they're setting it up.
I mean, he also describes it as lips and anus cut along the mucosa and grafted to each other's face, V-shaped incisions that are linked from chin to cheek to anus, and he's trying to make a Siamese twin. I think the bigger question is, can we discuss the structural integrity of this human centipede? Because it does not look very structurally sound.
I think as a line drawing that he has, like, that's the idea you have in your head. You're like, this is what my human centipede's going to look like. It's going to be great. And then you line all these things up, mouth to anus, and you realize that that's not how people's bodies line up if they are mouth to anus.
Correct.
So this is some artistic license here where
it's mouth to tailbone.
It's right. It's mouth to tailbone, and that's so that you have an actor who can breathe during the rest of this movie. If you really went,
you mean you don't want your actor to breathe stinky fart air?
I mean, I think they're breathing stinky fart air no matter what. But in order for you to see their faces and expressions, and also not to literally surgically connect them, you put their nose where they can still breathe.
Yeah.
Which means that their head is really above the exit hole.
And it also lets the female actresses arch their back and just gives you a better shape to your human centipede.
It does. Otherwise, you'd be kind of like neck pushing you down in order to maintain the position, and it would be real uncomfortable. You'd have some back pain.
Can I say I appreciate that Courtney's trying to just aesthetically develop an aesthetically pleasing human.
She did write down on her notes, I would like my human centipede to be the prettiest.
It's important in Hollywood.
It's the prettiest centipede of all the centipedes.
Because otherwise,
Jackson,
like,
you got a guy in the middle that's not even touching the ground. You made a bad choice to start.
Just floating away. Legs and arms just akimbo, just flailing around. Didn't do anything.
If it were anatomic, you could have the first one at the front, and then the second one behind, upside down, and the back one. Right
Ooh.
Someone has done her human centipede research.
Lipstick centipede?
I wish everyone could have seen my hands as far as making that work.
What Courtney gestured was her hands going upside down to the next one.
Yeah, they would fit together much better.
Yeah.
Still not a lot of easy breathing room, though.
Oh, no.
It wouldn't really work for the PG-13 rating of this.
Yeah.
No.
You need
this is only rated PG-13.
No. This is a hard R. Okay. Not crank hard R, but pretty hard R.
Crank hard R.
Crank was the hardest R movie we've done on this podcast.
I think I need to...
So far.
Oh, Courtney. You'll be here for Crank 2, probably.
Okay, deal.
Yeah.
What about Centipede 2?
No. That one was actually marketed as 100% medically inaccurate.
Really? So now I'm curious.
No, don't be curious. No. It's terrible.
Yeah, Human Centipede 2 is for Horrortober 2020.
Okay.
Horrortober.
Horrortober.
Anyways, so after Dr. Heiter explains his entire plan, he gives everyone propofol, knocks them out, and I actually do appreciate that they use something that looked like propofol instead of like in 24 and in other movies it's just a clear liquid. They actually used a milky white liquid, and if you don't remember, that's the stuff that killed Michael Jackson.
That's not really what killed Michael Jackson. Michael Jackson was killed by poor doctoring. That's the right thing.
Poor use of propofol?
That's correct.
Bad medicine?
By
bad medicine. But also, like, none of these people were on any kind of, like, oxygen or respiratory support.
Like Michael Jackson.
Yeah. But in truth, that is okay to do with propofol if you are doing it in a short span.
All those people
You're saying it's used for twilight anesthesia.
Yeah.
It is used for induction of anesthesia. And you can induce someone to go to sleep. You would not want to keep them asleep without continuous monitoring, without breathing.
Which none of these patients had. And they were out for a while.
Well, they did have the whirring and clicking sound. Maybe they had something off screen.
It's like non-invasive ventilation where they just kind of blow air straight into the face from the ceiling kind of down. But then the third girl got wise about all the other two getting injected with propofol, and she ripped her IV out.
Right.
Second girl.
Right. And that's
second girl, correct.
I think
third victim.
Third victim, yes.
Second girl.
I was like, damn, I did fall asleep during this. There's a third girl.
I watch a lot of creepy horror movies. This is one of those times where I cringed when the IV came out and it like pulls up through her vein and her arm starts bleeding. That is not medically accurate. That is not a thing that happens. People can can do a lot of weird stuff to their IVs, and they might have a small rip because they're very small. It's not even a needle inside their arm. It's usually a little piece of plastic.
Plastic catheter.
And so you could do a little bit of damage, but you can't do a lot of damage.
I will say though, I've had patients in my ER that have gotten really agitated and they rip their IV out, and it's a bloody.
And that's true, and that's very different. You can have a lot of blood because you're in. You have a direct line into the vein, and you have a hole going out the skin, and so you can get a lot of blood work, and especially blood coming out, and especially if you are then, running away from someone and you're excited, your blood's going to be pumping hard. I think, unlike most movies, there's an accurate amount of blood.
Yeah.
Oh, see, I would say it's a little more. It looked almost like an arterial line had been pulled out, that it just kept going as she was trying
I think that's because she's
block
running.
him
She's
out
like,
of the room,
I'm all pumped up. You're not going to get a good seal if you're not holding it.
I mean, as a guy who's seen patients pull out IVs not too long ago, like that kid yanked it out, and it just blood was flying and dripping everywhere. And if he did run out of his room and down the hallway, he probably would have left a trail too. And I think it's an appropriate amount of bleeding, which is a very rare thing we say on this podcast.
Yes.
Yeah.
It's usually not enough blood.
Not enough blood. I would say enough blood for this one.
So
Wait a
there we go. 100% medically
I
accurate
was just going to
for
say that.
For IV ripping outs.
yes, for 1.2 seconds.
feel
Up
like-
to date, right? 100% medically accurate.
Courtney, do your
He
patients have that
He
much
hasn't
blood in them?
attached them yet.
Yeah.
My patients have 100 per kilo of blood in them.
What does that mean in real world, doctor?
My patients have about 10 ounces of blood in them.
And how many times have they ripped out their own IV?
They don't typically.
Are you saying?
Every once in a while they do.
How? They're just little.
That's why it's too much
Little
blood.
IVs.
Because that was like a whole person's
Yeah.
worth of blood to Courtney.
So, So let's move on from that part, and then Dr. Heiter, who got really frustrated at the girl who ran away, who did not get propofol, threatened to shoot her in the head with a sedation rifle. Would that be a viable way to sedate someone?
That would not typically be a viable way to sedate someone.
Why not?
One would hope that the sedation dart would bounce off her skull.
Well, I mean, I watched Old School. Like, he got shot in, like, Will Ferrell got shot right in the neck area. Like, he could have aimed it for the neck, I guess.
And the neck, you could argue, if you hit a muscle big enough, you can get an IM injection of it.
Mm-hmm.
I think that's a common misconception that we've seen a lot. Whenever somebody wants to, specifically to knock someone out, they go for a vein.
Yeah.
And in actuality, that's not what you're doing.
No. We try to go for, like, big muscles.
Yeah. You want to make sure it gets stuck in there, and you want to make sure that whatever is injecting is actually going in a thing that it can go into. If somebody's calm enough that you can inject them in a vein, then it's a whole different scenario.
Yep.
But like it's something like this where someone is agitated and running around. Usually
And you're trying to shoot them.
Yeah.
And that's also not a thing. I think it's important to realize if you're getting your information about medicine from a TV show or a movie, it's probably wrong.
Or a horror movie.
But I think that's the
with
whole
dart
point.
I will not lie. There are times when we joked about getting a ketamine blow dart for some of those angry patients.
I mean,
That
just
some really
would
something.
be a lot of fun.
That
However,
would be
I've never
great.
seen it in a hospital
No.
setting.
right. They don't,
In a hospital setting.
Usually it's us like running with
Double
with the
key turn,
needle,
get
like
your-
holding them down.
Ketamine
Well,
and
you
gun
want to
out.
catch someone and keep them
Doctor,
from hurting
doctor.
themselves
Right.
and hold them down safely, and yes, all of those things that we need to do in real
So-
life. But in movies, you get a dart gun.
So you don't just go like, doctor, here's your blow dart or your blow gun.
And
Well, what if you hit somebody?
You get one.
I don't
You
trust
only
your
get
aim.
you only get one. I can't hurt that many people. I only hit one person.
What if you hit him in the skull?
Then bounces
What-
off like you just
Bounces
said.
off.
Come
There
on.
you go.
You just
that's why you have a backup.
yeah. That's why you just explained.
They don't tell you
Right.
about the backup in the movies.
Yeah.
Everyone's
So
got a
one thing that
backup
I'm
cannon.
not aware of with dart guns is how does it inject?
You don't need to worry about it. They don't exist in our world.
No,
Do they not
they
exist?
exist in animal
Tranquilizer
world.
guns.
I feel like they
Well,
do.
they do. They're injecting based on the physics of what's happening.
Yeah,
This
so-
thing is moving, and then
the
it stops
movement of
something,
it?
and then
And
it's
then
like
the plunger
there's
pushes
a
the rest
plunger
of it
and then
in.
pushes it.
Yeah.
Are you guys just making this up?
No.
Okay.
No, that is actually
Only
how.
Courtney appears to know more than she actually does.
I know you don't have to dart gun your NICU babies that often, but that's
We
actually.
try
how-
actually not to dart gun our NICU babies.
They finally do shoot that girl.
They get her.
They do get her, but they get her in the shoulder blade.
Mm-hmm.
And we were talking about
Oh, yeah.
bone injections, not
So, yeah, if you are going to inject someone and you need to take them down, and remember, if you're not in a vein, it's going to take like 5 minutes after you inject them. She got hit in the shoulder, and that would, I mean, anything over your bone hurts a lot. If you ever have gotten a tattoo that's overlying bone, like your ribs or your spine, that is where it hurts the most. Also, bone marrow biopsy, as Courtney is informing me, which is, those are generally considered some of the most painful things you can have done.
Yeah.
To get shot with a dart in your shoulder blade, that would be a big
no-no.
That'd be a painful thing. Although it knocks her out pretty quick. So.
It does.
So maybe it hit the muscle over.
I would hope it would, but there's not that many muscles right there.
It's thin. It's a thin
And it's a
muscle.
very, very thin muscle.
Yeah, it's
but
going into the bone.
She's pretty out, as
She
her
is.
friend is trying to drag her through
All of that stuff.
wherever.
Yep. But it does transition to the surgery scene very well, where it is very graphic how they do the surgery. So they explain that they go through the kneecap and they cut that off, but no one is on respiratory support at all.
Yeah.
Overrated.
Except for number one.
Number one is on respiratory support, which is weird because he's the only one whose
Got access.
mouth isn't
Yeah.
going to be messed with during the surgery. Because the rest of them are getting flaps done, and a flap is just a fancy word for a loose piece of skin that you can sew onto another.
Someone else's
Another
face.
Usually it becomes part of your own body.
Yes.
You have a flap
To be
cover
fair,
up other
number
things.
one also had a flap done
He did.
He
on his
did.
butt.
A southern flap.
That might be the best, classiest way you have anyone has described this procedure by far.
I think if they'd named this movie The Southern Flap instead of Human Centipede, it might have been an Oscar contender.
I was gonna say the same thing actually.
Say what you will, whoever plays Dr. Hyder is killing it.
Yeah.
Like,
Oh, he's doing a great job at being horrible.
Creepy.
He is super creepy.
Creepy.
Like we kind of brought this up earlier. If someone asks if you're alone and it's that guy,
You
you
run.
turn around.
You say
and
no.
go,
Actually, there's 10 more of us in
Yeah.
the bushes
There's
to
a
the
bus.
side. And
Please don't
all of
refit
our
me.
parents are police officers. And
Yeah.
they told me they'll never quit if I disappear.
I'm here with the
So-
Dallas
That
Cowboys.
doesn't typically work in
Dallas
movies.
Sometimes. We've never seen it.
Somebody
in a
no
movie.
one
We never-
noticed going missing.
Yep.
It is crazy
Oh,
how the
ouch.
guy is the only one with respiratory support.
And he's the only guy doing the surgery by himself.
And I think
Yeah, but that's kind of understandable given the surgery.
You mean in
He's
his house?
performing.
And I quote from the description from his House Coombe Hospital.
School Hospital.
Yes. Like he's doing all this by himself.
She could be nasally intubated. That would get around.
She's
his
not,
issue.
She's not though.
I
She has
know,
no
but
tubes.
I'm saying 100% accurately medical.
Save,
she could
save
be.
it for how do we make this movie more medically
Also,
accurate.
you can't get apneic oxygenation from an anus. It's impossible.
What is atmic oxygenation?
So sometimes before we intubate a patient, we put oxygen on their nose to just increase the oxygen saturation in their blood. It's really hard to do it just from their butthole.
You would get atmic methanization.
Methanization.
Methanization,
Very nice.
correct, yes.
Because you're thinking something comes out.
Also, he is just violating a lot
he
of
just
sterile
touched his
procedure.
face.
Like, he spent all this time being very careful,
Wait, hold on.
moving
There you go.
heads.
So that is part of this whole, like, these are parts that are and are not medically accurate
Yes.
during the surgical portion. And I think that's probably where we can spend a little bit of time kind of breaking down what
Yes.
actually happens and what doesn't.
Yes.
Courtney or Jackson already said there's not a lot of people there and there shouldn't be a lot of people there. This guy's doing a creepy thing.
Mm-hmm.
But he also has the right equipment and the right stuff going. Like,
Yeah.
the things that are happening make sense.
I
Except-
still don't see monitors though.
I don't think he cares
Yeah.
about monitoring.
But he does.
He does, though. He
does.
wants his creature to
cares,
come
but
alive.
he's not
And so the guy
replacing-
that needs to breathe is breathing.
Yes.
Granted, the rest of them also need
Need
to
to
breathe,
breathe.
which is why it doesn't.
And he
make as
does
much
try his best to maintain sterility by moving number one's head with his elbows, but then completely violates it by scratching his
scratching his
forehead.
head.
Face,
during-
yes.
Yeah.
And we've talked about last week actually that the sterile point is generally your
Chest
area.
Yeah.
Yeah.
Below neck
Neck down.
Anywhere you're not going to sneeze from.
No, chest is
Or
still
cough, as this
sterile.
episode.
Like,
Yeah.
Here down.
Boob?
Yeah, chest is still sterile.
Chest is fine.
I think this depends on the. What,
it depends how
when you're
big
talking about
traumas you are.
sterile, what do you mean here?
Surgery.
Right. So the sterile areas, wherever they're operating, they keep that sterile.
Yeah. And then on themselves, it's like the chest.
Oh,
Yeah,
that's
the
what we're saying.
chest,
Okay.
And
Yeah,
then,
I'm
like,
sorry.
waist down and your back is not sterile
No.
when you're in an operating room.
No. And I think it's also kind of crazy, too, that when they're recovering from all of it, the only one who gets any kind of oxygen support, number one.
Yeah.
I mean,
The head.
But the other ones need to live, too. You can't have a human centipede with just number one dragging around a bunch of carcasses.
it's true because it's very clear that he does not, like, the rest of their insides are not connected. It is just that, your inner outside tube
Yeah.
that he's connecting. So everything else, he needs all of that to work. Their respiratory systems aren't connected. Their circulatory systems aren't connected.
Yeah.
It's just their gut. And you do need those other segments to breathe.
Yeah. And I would say this is one of those situations where he also explained it's really painful. Like, it's going to be a really tough recovery, right? So if number one gets opiates, this is going to be like a thinking question, like a philosophical question. Will number 2 and 3 get opiates too? I mean, they're getting blood supply.
It depends.
I think that given how little of blood supply they're getting, it feels like it, because medicine in general is based on weight, and we assume an adult is a certain weight, and this would be 3 adults. So he would really have to up the dosage.
One Chicagoan.
So what if he
I'm
gives
from
the
Chicago.
first guy...
I used to live in Chicago, but it's an easy joke.
Here's a question that'll blow your mind. Give the first guy a 3-time dose of opioids.
Uh-huh.
Does everybody live and be happy, or does the first guy die?
God, that's a great question.
I think because they have flaps, so their circulatory systems are at
Technically,
least rudimentarily
but
connected.
it's going to go through his heart first.
first, yeah. So number one might
I
take the
think he
brunt of it.
dies.
I mean, when you're talking 3 times a dose, what dose are you starting
A
at?
happy dose.
I don't think this guy's too concerned about giving adequate pain control.
No,
No, it's more an academic question.
it is. We're trying to make this human centipede ethical.
And also, I think
100%
I think
medically
part
accurate.
of what he's saying is he's trying to make this recovery as I don't think he's giving them pain meds. I don't. Like, that's what I'm looking at now is I'm not seeing a guy that's concerned about the difficulties in another person.
Yeah.
He seems like he's more concerned.
I mean, he
about
kind
what
of treats this like his.
Well, he still
More
has an
than
IV,
anything.
though. Number one.
But that means number one's getting all the brunt, but no one else is getting it, right? Like,
Do they have IVs?
no, they don't have IVs.
Well, he's still getting an IV, but he's also not getting fed yet.
Yeah.
Also,
Yeah.
all right. So let's talk about medically accurate. His hands are in gloves. You can see how sweaty his hands are in those gloves. For me, that was a nice touch of accuracy.
That's another 10% right there.
Whenever I had to do anything
I hate
surgical,
that.
So
was-
what? 89, 88% medically accurate.
my hands would be just wet bags inside of gloves.
Can you live with just coprophagy? If you-
What is coprophagy for the non-doctors in the room? I mean audience.
copro means poop. Phagy
Eating
means
poop.
eat.
Eating poop.
So can you live with just eating poop?
I have a dog.
Okay.
So, yeah.
My dog would contend that
Is
yes,
that
you
all
can.
that he ate?
Yeah.
In his dream world, yeah.
Our bodies are not 100% effective. In poop, there's going to be some nutrients, but also poop is dirty for you,
Yeah.
right? Like that's why people don't eat it, and for among many reasons.
I mean, there's many reasons why you shouldn't eat your
but
own
it's
poop.
it's going to already be nutrient poor, so it's
Yeah.
going to be really poor food to be eating if that's what you were eating. I would say no. I would say don't do that.
Yeah. Also, this system is very airtight. There's like no leakage.
Luckily, you don't need air in that system.
But I mean, if you're gonna poop, like if that first guy pooped, I would expect something coming out of
Yeah, I
stitches
imagine.
and stuff. I'm
it's
gesturing stitches.
It's a pretty nice
inside them.
anastomosis there, so it's possible it just goes through.
What is
What is
anastomosis?
What is anastomosis?
An anastomosis is joining of two tissues with suture.
I mean,
Yeah, no, she's right.
yeah,
That's
yeah,
what
she
it
is.
is.
They use some really good staples, but also you can tell where Dr. Hyder's non-sterile technique is his downfall because number 3 does get a really bad infection.
Yeah.
Now, first question. I really don't feel like, despite the fact that, yes, they did a good job with the surgery
Oh.
itself,
They are staples.
I don't feel like this would be a structurally sound
No,
and
it is not.
And I have always said this is not a physics podcast.
Right.
Yeah.
But this is still medicine because you could pull your face away if you really wanted to, and dear God, would I want to.
Well, and this is where the sedation comes in, because with the amount of movement that they're doing and fighting and pulling, then yes, definitely not structured down.
Those tiny flaps that you see, which are the kind of pointy triangle scars on their faces, that would be
the why so serious scars.
Right.
Yes.
That would be a really poor way to say these people are going to be attached forever.
Yeah.
They do address it slightly by having like the bandages wrapped around the head so that they couldn't just totally rip their heads away. But it would be a very weak anastomosis.
Yes. I mean, there's no time for it to heal, and you probably want them to be really heavily sedated for that to heal.
Yeah. And not only is there not a lot of time to heal, at least from our movie, like they don't have time passing, but who cares? But anything that's healing you want to keep clean, and because these wounds are in the area of fecal matter, it's automatically not clean.
Yes.
So what I'm hearing is don't poop into your surgery incisions.
Yeah, it's a good
It's
idea.
poor form.
It's like the old adage says, don't poop into your surgical incision.
Somebody write that down.
Someone should cross-stitch that
it
into a pillow and just put that somewhere.
My grandpa said it to my dad on his wedding day, and my dad said it to me.
I do think it's funny. The one time when we were watching this movie all together, where I think Johnny almost vomited, was when the Japanese guy had to feed number 2.
Yes, and we watched with subtitles to make sure that we can be as accurate as possible. And
We
so
didn't miss a thing.
No, we did not. And the subtitle said, and I quote, "Feces squirting."
Yep. And I
Threw up a little bit in your mouth.
Yeah.
just a touch.
Which
just
is
a touch.
the greatest segue ever. What would happen if number 2 or number 3 threw up?
I feel like it would be like an enema.
It's coming back the other way.
It'd be really acidic. I assume enemas aren't.
So
Not
that just means more
typically,
food.
but
No, the thing is, if they did throw up, it's going to go forward. It depends on how deep he went into this anastomosis.
Quotation
I love that
marks.
that's your new favorite word.
Yeah.
I mean, I can use it more now. So it depends on how deep he went into that, to either the rectal area or into their mouth to like make a really good tight seal. But if it went forward, it's a tube that only is designed to go one way, and it's always going to push backwards.
It's got to come out those suture wounds.
I mean, that's what's going to happen. I'm saying if
Not
it was
if
a
it's
good...
a good
saying if it's
anastomosis.
a good seal. If you really got those tubes together well.
Oh my God, there's so many titles to make from this podcast.
Well,
right
and this
now.
is where the actors come into play, because you can really tell that they're not comfortable when all this is happening.
Yeah, but that
Bad
might just
things
be
are
the
happening.
situation. Although they came back for the next movies, so
Well, the middle one did, right?
the middle one did, the front one did for one of them.
Oh, I thought everybody died.
The actors
they
come
do
back.
some reshoots.
There's
Okay.
the Human Centipede cinematic universe.
Yeah. It's called, it's first sequence, followed by full sequence,
Oh my God,
then
I'm
followed by final sequence.
So glad you guys are educated.
Like the
me.
Final Destination. Oh
Yes.
my God, we have to do Final Destination.
Later in October.
With the
that might be
tan
there.
booth, or the...
We can even... Alright,
Saw is going to be
this-
appearing on Netflix by right around the time this episode comes out, so I think we need to do Saw, Final Destination, and Flatliners.
Yeah.
Here's the thing
And
about
other movies.
Final Destination 4 it's just like in the either beginning or the end, they just go through all of the deaths. And it's just a really nice, clean
Synopsis.
We don't have to deal with any other parts of the movie other than
You're just looking forward to 10 minutes
Yeah,
of research and we're here.
Which is
So-
the one where she dies in the tanning booth, and they like...
I believe that's
that's 3, right?
Yeah. So don't forget to subscribe.
Yeah.
Because we're going to be talking about a lot of horror movies in this month of October.
with an H, right?
With an H, correct. The other thing that Heiter made a threat of was cutting everyone's vocal cord because they were crying and whining so much. I think if you cut someone's vocal cord, they don't breathe really well.
That's very true. It's sort of there are ways to injure your vocal cords. One way injures it with it sort of in the middle, and one way injures it with it stuck to the outside.
Yeah.
And depending on how it's injured, it can be very detrimental to your future breathing.
Yeah.
Now, as I've mentioned, I'm not a doctor. But I think that having your mouth sewn to someone's butt
Okay.
also detrimental to breathing.
I agree.
Yeah,
And
yes.
You saw the nose, though.
I think
do have
Dr.
nose.
Hyder assumed that was going to cut down on their talking in general.
Yeah. But here's the thing. Your vocal cords, if they slam shut, there's no air moving to your lungs anymore.
Yeah.
And that's the bigger concern right there. So him threatening to cut off the vocal cords is essentially, I'm going to kill my human centipede. Unless he does something crazy where he just puts a nasal trumpet that goes all the way
If
down.
he cut off their vocal cords,
I don't think this is the kind
you
of
could totally
doctor.
separate the vocal cords and leave the airway open.
I don't think this is the kind of doctor that's going to do something crazy.
No, I don't get that impression at all. either.
Seems like a stand-up guy.
Unlike his patients.
Yeah. That is terrible.
Oh, so Jackson brought this up earlier about the pointy flaps, and I got sidetracked about it. But when you are doing surgical stuff, you want to make sure anything that you're attaching to something else has pretty good blood flow.
Legal in this state.
Mm-hmm.
Button flow.
And so you try to avoid sharp, pointy things that could potentially not have a lot of blood flow. So instead of seeing that like pointy triangle on someone's face, you'd probably see kind of a bigger,
Like a nice clover.
yeah, like a clover or a bigger
Oh,
curve.
that'd be aesthetically really pleasing
Wouldn't
too.
it be
Yeah.
better looking?
Yeah, a nice soft curve.
Imagine when you drink too much and your friends draw something on your face.
You mean the aftermath of this podcast?
That's more
Yeah.
of the shape you're looking for.
Oh, yeah, for sure.
Better way to say it.
That is a
Greg.
better... Shout out to Courtney for saying that. Not so PG the first time.
Right. I'm trying to look at all my notes, and there's so much other stuff. Dr. Hyder getting bitten in the neck rather than stabbed.
I think that's more horror movie trope than anything else.
Yeah.
And since...
Could have been bloodier.
I think it was the right amount of blood considering it didn't kill him. If he actually bit into something important...
He eventually did die. Well, no, he
No.
got shot in the head.
Yeah.
Yeah, different
It was
guy.
more... No, when he was crippled, it was because he got stabbed in the foot
Yeah.
and shins.
Yeah, there was a lot of knee violence in this movie, I think.
It wasn't good
There
about
was a
it.
good amount of knee violence. Like, patella's getting slashed, him getting stabbed in the knee.
For a
Hot
second,
take.
I was like, knee violence? What is
Tom
that?
Six
I
hates
gotcha.
knees.
Tom
Shout,
Six
shout
is
out to
really-
Jason Mantzoukas for knee violence. There's
Yeah.
a lot of knee
There you
violence.
go.
in
There's
this
a
movie.
lot of knee violence. I'm trying to think if there's anything.
Gosh, my
Oh,
knees
yeah.
hurt just thinking
No
about
one peed. None of the human
we
centipede
didn't
never
see
peed.
it. We didn't see it.
That's what I was saying earlier is like, for as gross as everything in this movie is, they let a lot of that stuff happen in your own brain. Like, I mean, you don't... Like, you see him reach into the mouth, and then he pulls a tooth out. I do not think that was an accurate amount of energy to get a tooth out.
No.
But you don't see any of that happen. You don't really see any of the cutting except for one small little bit. And you don't...
See the bodily functions.
and you don't see
Unless
the bodily
have
functions.
subtitles on.
Except for the poop.
Except for the...
But you don't... You
have to hear the
and
poop.
and actually, you don't even really... It's not, like, played up for anything. It's just, like, you know that he's pooping. I mean, also... The guy says
I think
he
it
has
says
to poop.
he's pooping, yeah.
Yeah. Quote unquote, feces squirting.
Yeah.
I will say there is one thing that for sure makes this movie not 100% medically accurate, and that is when he puts his stethoscope in, it is
Oh my
backwards.
God.
Oh,
Wait,
movie
it's
ruined.
it's not the attaching of the mouth to the anus. It's
I mean,
the
I don't know.
stethoscope
I mean, it's
backwards.
that's medically accurate for what he did.
I guess you could do it. That's true.
But if somebody is a doctor, there's no way that they are putting that stethoscope in backwards.
That is my serious pet peeve.
99.7% medically accurate.
At least at this point in his career. Because I think at some point in all of our careers, we were like, oh, it seems like it goes like this. That's what I always see on TV.
I don't know why I wrote down bloody poops are the worst smelling poops.
Because
I mean, it is a fact.
Oh,
the
because
head was
he
starting to bleed everywhere.
well, because
they died, right?
no, it was because
good.
number one bit Dr. Hyder's neck.
Yeah.
And his face was covered in blood, so he probably swallowed some blood.
Bloody poop does smell the worst. It also smells... It is one of those things that is a distinctive diagnostic smell. When you smell somebody who has blood in their poop, you know immediately what it is. There's not a question about it. There might be a question as to why, but you know that that person has blood in their poop.
And there's bad news.
It can... I mean, likely there's bad news, but it doesn't have to be. It's not
It
great.
It could be.
Here's what I'll say. It's definitely not good news.
No.
It could be bad gum disease.
It could be. I mean,
It could
usually
be a
when you get that smell,
That's a
it's
GI
because
bleed.
a lot of blood has gone through the digestive tract and been digested, and it is just very distinct. There's not a whole lot of things that are like that. Like a wound that is infected with certain kinds of bacteria has a very distinct smell. Dead tissue has a very distinct smell. You do not think it's anything else. And then C. diff, like a particular type of bacterial infection in your gut,
It'll
has
peel
a
the paint off the
very
walls.
distinct smell.
Yeah.
But a lot of times in the ER, you might see outside of a room, they put out a bunch of coffee grounds and like a loose coffee filter,
Yep.
and that's usually trying to cover up the smell of bloody poop.
It works really well.
It does work really well, except for now there's like the distinctive smell of coffee grounds and bloody poop that is...
It's when you pass
Over.
that. It's when you pass the event horizon, like between ER and patient room.
All right,
And it
after
smells
this
so.
conversation, I'm going back to the NICU.
you have to go to
What,
work.
you got to deal with more bloody
No,
poops?
we don't have problems that need to be covered with coffee grounds.
Really?
Not typically.
Well, aren't we lucky?
I know.
But I think it does transition well to how the first guy dies, the front of the centipede. Because he does cut his neck after you're biting a chunk of Dr. Hydra's neck. But then he dies by exsanguination. But there's a big question that we all had when we were watching this movie. Does his bowels release?
How quickly does that happen? I know from my bad CSI podcast that people poop after they die. I don't really have a bad CSI podcast.
It is not sudden.
I gotta be honest. I only know that from watching TV, so I don't know if it's true. I assume that it's true.
So
I have no idea.
I will say patients that I've coded and then aren't able to resuscitate, they don't poop like right away. But it's when, because, you know, they do go into rigor mortis sometimes, and it does take a while for it to come out. However, if they do have like neurologic damage, they do poop themselves.
Yeah, I've been with a lot of patients when they die. I am a hospice doctor. It's less. That sounds worse than it is.
It's part of the job.
It's part of what my job is, and I can't. There's never been an instance where someone died and then we're like, "Oh, that's gross" because they pooped. That's not what it is, and so
Sorry, Hangover 5 writers.
it's still really weird because that's something that we all said,
Yeah.
and yet
Yeah.
it is not true, and it's not true even based on our experiences
Correct.
in the room.
So I guess my final question to everybody here is, how much percent would you say?
I've got two questions.
Okay,
Well,
let Johnny do that
I've got
first.
one question before
And then we'll
that.
close
All right.
with how
Well,
much
we've also got the big question.
I know we
What's
have the
the
big
big
question.
que- oh,
We'll
yeah.
get there.
Yeah.
So, question one. Greg, the teeth.
Oh, so he just said he's going to pull these teeth out. I think this will bleed over into the big question. But if you were going to do this right, you really want to get those tubes close. And your mouth is not really a part of that tube. It kind of starts further back. So if you take all the teeth and stuff out, you can really mash them together.
And he only took out 4 teeth, though. He only took out incisors.
No, he took out incisors, canines, and something else that I don't remember. I mean,
Because this is not a
dental
dentistry podcast.
Yeah.
Well, but talking about trying to keep the anastomosis sound and how pulling on it can be an issue, you can imagine an awake patient biting down on the tissue in front of them.
I prefer
may
not to imagine that.
Johnny, you can imagine
You
this.
can imagine it.
Oh, I have to
It
spend
may
5
not
hours editing
help-
this.
It may not help the experiment continue, so I can understand why he would want to take teeth out of the equation.
Now, would you be concerned in this instance that, you just removed a bunch of teeth, so you've got a bunch of open wounds in the jaw,
Yeah,
and then someone's going to poop?
Well, that's part of what we sort of saw. We see a really bad infection in this movie, and it's like everything that's happening here is in a dirty area. So you would have to. I mean, people do get surgeries on their bowels, and they are successful surgeries. But it's about really keeping things clean,
Yeah.
making sure that every precaution you can take is there. And in this case, this guy is just sewing 3 people together whose blood types match ish. We don't
Tissue
really-
types.
Tissue types.
Well, and this is obviously an experimental procedure, and so you do need, you have to choose.
You gotta
risk
start
versus
somewhere.
benefit. You got to start somewhere. He doesn't want her to bite somebody's butt off, so he takes the teeth out. Maybe he didn't think about the infection
but
risk.
wait a minute.
But did
And
she
he
take it?
will
But
for
did he?
next time.
But did he take into account gumming someone's butt?
I don't know that gumming can do as much damage as biting.
It just, I think those people would be at a lot, like, having your teeth removed is a big deal. That wisdom teeth out, it's a throbbing recovery, and so
That hurts.
Yeah.
to be, having your mouth cut open, having your teeth pulled out,
Having your butt
and
cut
having
open.
your butt cut open, hashtag middle piece. It would be
Middle section.
middle section. Yes, it would be. This would be a real tough recovery from
Yeah.
a pain standpoint.
Yeah.
I want to talk about why this is a real horror movie to me. And it's so two of these characters are American, and Courtney just said that this is an experimental procedure, which means this wasn't covered by their insurance.
Probably not. I don't get the feeling he's gonna bill them. though.
And I also feel like it's an elective experimental
It is
procedure.
elective.
So
Ooh, it's definitely not going to be covered by anything. Oof. What was the second question you had?
Well, yeah, the second question is the big question. But first,
Well, how many percent medically accurate would you say this movie is? I'm going to go... I'm going to give him 85.
Okay.
I'm pretty high. I'm giving him a B+. plus.
I mean,
Or B. Solid B.
Courtney, what do you think? I want you to weigh in before I weigh in.
Let's talk about the elephant in the room that this man attached 3 people together along
But-
their elemental track
for real, though.
to make a
Do you
human
think-
centipede.
do you
I
think that's
think this
possible?
is 100% medically accurate?
Do you think that's a thing that could
I
be
think as
done?
far as like the small
Courtney, I want you to
aspects-
go on record here. Do
Yeah.
you think this could be done?
All right, so as far as the small
Dr. Courtney
aspects
Nicholas.
of surgery,
Yeah.
the bleeding after the IV came out, the little bits here and there, that's accurate.
Okay. How many percent?
Sewing people together in that fashion, I think that your survival time would be actually probably the extent of this movie. So yeah,
An hour and a half?
I'll go.
I'm going to say about 40%.
92.
That's what I'm going to say.
She said 92.
Yeah, okay. That's fine. You guys are blinded by Hollywood.
I prefer the term optimistic.
This is a movie about optimism, guys.
I think there are a lot of cool things in here that pay homage to accurate medical stuff. It's also just nonsense. I mean,
It's nonsense.
It is nonsense.
but it's also fun nonsense.
There is one medically accurate bit that I do want to bring up. So the patient 3, segment 3,
The tail.
actress 2,
Yeah.
The tail.
the tail dies of septic shock.
Yes.
Septic shock, is that accurate?
I think she just dies of sepsis.
Okay, those are two different
The
things.
shock
I'm not a
is
doctor.
implied.
It's
Shock
is
implied,
implied,
agreed.
yes, correct.
Septic awe. For once, we saw, based on you folks' reaction, we saw coloration that matched what they were describing.
Yeah.
A dead person?
Yeah, she had really...
And someone dying.
She did have a dead person.
She had real pleural perfusion. Like, she was real pale. She was gray. She was really altered. She was really woozy. And she looked like someone who was dying and or dead. And here's the thing, though. If she did die and she just collapsed, I would assume that her face would just rip off the butthole.
Yeah, all of her weight would be pulled onto those puny flaps.
Yeah. Those are some puny flaps, if we
But-
haven't said that before.
Puny south flaps.
I'm gonna get all scientific now because then we have to go to what about the sharing blood supply?
Right, so that if
Between
she's
people.
septic, they would all be
All be
septic.
If
septic.
she's septic,
but-
they're all septic, and if she dies, her blood pressure goes to nothing, and then all of everybody else's blood goes into her body.
How much of
And
their
they
blood
die.
blood supply would be shared at this point in time?
So let's say this is an optimal centipede. A third or 2/3 would go to that one.
Centipede.
That means if they got all their blood supply going into their face, that would be supplying the rest
Her
of
face
her
would be very rosy
Yeah.
before it became very pale.
Yeah. Actually, you know what though? Those flaps would actually remain rosy, technically, because that's some
Because
blood
that is
supply.
hers.
How long would that take?
What?
The transference of blood between segments. My
I'm
God,
not
I'm
a-
getting too into this.
I'm not a human centipedologist, but there's not enough blood. I mean, if you want to explain it physiology-wise, there's not enough blood supply going from all 3 of them through just those tiny.
Even
flaps.
this at some point in time there would be blood transference, though, correct?
Probably.
But it would be very minimal. So like if you cut yourself and you have to get stitches, they don't have to sew every little vessel back together.
Correct.
If you have a huge deep cut and it cuts through a major vessel, they have to repair that vessel. It's a volume thing. And so in this, they're just saying like, oh, you have some tiny incisions, we're just sewing them together. And that actually might work, assuming people had the same tissue types and not rejecting each other. but you wouldn't have the blood flow that would cause someone to crash.
Yeah.
But if someone had bacterial infection in those vessels, that would go to the next.
Okay.
That would happen, and so that sickness would definitely at least be in middle section.
It would take time, but yes.
Not if it's dripping pus like that and your blood supply is connected to it. She would get at least those flaps would get infected. Now,
Yes.
some people are healthy enough where they can fight off an infection like that, or at least not die like she did. But it's interesting because they definitely aren't depending on each other's blood supply, but the bad things that happen would affect each other.
Okay, so there's a little more medical accuracy, maybe-ish.
I'd say it's about 40%.
I hope that we, moving forward, I think we should hold films to the Human Centipede standard.
40%.
40%.
40%.
This is
goodness
going to
is
be our
good.
standard?
Yeah, if this is 100%,
Right.
then
Oh, I see.
then
I
The
see.
Office, the injury, was
Yeah.
a 1,400% medically accurate
Yeah.
Where
piece
do
of
you
television.
land in comparison to the Centipede?
Before we kind of finish stuff up, I want to clarify. When I said he was wearing his stethoscope the wrong way, I mean that when he put it in his ears, he put it in backwards. Because my dad, from when we did the Junior Mint episode, actually wrote me and sent me a picture of him wearing his stethoscope hanging around his neck the right way.
Like a necktie.
But that's a very different thing than saying he had the stethoscope on the wrong way in this case.
Correct.
Because Dr. Hyder actually wears his stethoscope the right way, except for when he puts it in his ears.
They are the
It's
backwards,
upside down.
The wrong way.
It's backwards.
The earpieces are pointing the wrong direction. So he's not going to hear anything other than his own blood flow.
He's going to hear his...
Because it's pushing against the walls of his ear. So, Johnny, is there a question you need to ask before?
There is a question I need to ask, and it's terrifying, and it's, how do we make the Human Centipede more medically accurate?
No.
I was going to say, so the first part of that is, do we want to?
Well, it's 100%, so we can't.
They're claiming 100%.
But it's somewhere between 40 and 97.
I think there's two ways to look at it. One is, I think you could do what he did. You could knock people, or you could even get volunteers for this and sew them up like this. I mean, people are weird.
We're thinking
Yeah.
about starting a Patreon.
But, so if you did that, probably what would happen is they would be so uncomfortable that they rip themselves apart.
Yeah.
Like, this is not a good way to secure people together.
No.
Oh, I'm sad I just said that. But the other way to make it more medically accurate is to bring those tubes closer together so there's less wiggle room.
I think any episode
Okay,
where...
I'm bringing the ethics committee into this right now. Who's going to volunteer for this?
I mean, I'm
Velcro.
Do you have
Fans,
Velcro?
super fans of the Human Centipede?
So Johnny is asking a simple question about how we make it medically accurate. You gave the right answer, which is you can't, right? You can't do this.
Or you should.
You shouldn't.
Or you should expect to see a medical...
You will be having an
review board.
ethics committee discussion,
Yeah.
and since I've been a part of those discussions, they're going to say, this is a really interesting conundrum. We don't have an answer. They will talk about it for a while. I highly recommend.
I do believe they may have an answer on this.
They're going to say, this one they're going to be like, normally we don't have an answer, but today...
Today,
Today,
the
I
answer is no
I
centipede.
think we can agree on this one.
Yeah.
No centipedes.
Let's not.
But
make this
80%
medically
agree.
But I think
accurate.
what Greg is hinting at is a more structurally sound.
Right, so
centipede.
if you remove
So-
more of those
Or
wiggle
remove the jaw.
places,
The jaw, probably.
really get them in
Do
deep.
you want like tendon attachment?
Also-
or,
No.
like you've got some
No.
nice fascia on the gluteus muscles.
No,
you
but
can
the
really-
other thing
You're
too
giving,
is-
Courtney,
bring
you're
the
being
whole-
gross about
You're
this.
being
Well,
way
no,
gross.
I'm
you're
just-
trying to make this
No,
structurally
you're sounding
sound.
like a serial killer. That's terrible. But I think just the simplest move is just moving from the tailbone just closer to the butt.
Right, and I think,
But that's gonna make crawling difficult.
but that's why you got to remove more of the stuff.
Yeah.
So you really have to go in.
So,
you
you know
have
what?
to kind of really dig into the face.
Then you
Don't
need
do
to-
this.
then
This
you
is
need
wrong.
to-
Don't
no.
do this.
This
Then you
is
need to
not
make a prosthetic.
medical advice.
No.
You just
And as Johnny explained in the beginning of this episode, before the episode started, this is not medical advice.
if there was a robot you could use from a previous podcast to kind of scoop out that tissue, who would it be?
You mean Two Scoops Doula?
Yes, the Two Scoops Doula.
Oh, I was also going to bring in another previous episode and could face off technology.
Yeah.
Oh,
You need to monitor some cyclosporin levels to make sure that's
I'm
fine.
ashamed that I didn't think about using face-off technology.
And jaw-off technology.
And jaw. Yeah. But you need to monitor their cyclosporin levels to make sure that it is okay and no one gets rejected. Because the last thing you want...
the last thing you want
Maybe
is
that's why he knew that the guy wasn't a tissue match.
Yeah. The cyclosporin levels were not good. This movie is horrendous.
Yeah.
I hope all of you watch it.
I was just thinking that.
What?
This movie is
Yeah, this is a horrible movie.
This is a horrible movie.
But I actually really enjoyed watching it.
Yeah.
Yeah.
If you guys want to watch along and see if you disagree with anything we say, go for it.
Yeah, I have to be honest, and this is the first time I really wish that we live streamed our podcast just for...
What, to hear Greg coughing for like 5 minutes straight?
Yeah, subscribe to our Patreon and get 5 minutes of Greg coughing straight in your email. And 5 minutes of me coughing. But, like, just for me sitting back and letting you guys roll and the face of my disgust
I've
of, like...
never seen you cringe
You were pretty quiet.
so hard. Yeah.
It's a pretty cringeworthy movie.
I will say, there was at one point, you just like, I'm looking at my cell phone now.
Oh, yeah.
I'm not looking at this movie.
Yep, I'm not a gore guy, so Saw's gonna be fun too.
So how is Hortober gonna be for you?
Horror.
Courtney, it felt like you used the W.
Yeah. You used a hard W in this one.
Hortober.
No.
Hortober.
No, you used a hard W in that
Hortober.
Hortober.
Yeah.
That sounds like a W.
No. You're just saying it wrong.
Well, if you want to know my thoughts on Horrortober, you can.
Hashtag Hortober.
I'm gonna actually agree, and guys, folks, listeners, don't watch Human Centipede unless you want to watch Human Centipede.
We watched it
That
so
might
you
be
don't.
the best advice.
I'm gonna say we watched it so you don't have to. But if you want to, and just to see what we went through, we're not here to hold you back.
Yeah,
I recommend. If you
think
meet
you should
the
watch
age
it.
restriction requirements, I recommend watching it. If you manage to get through this whole discussion of it.
Yeah.
Also, just stop at the first one. Don't go to the second and third one. You don't need to. The first sequence is enough.
Next week we'll do something a little more accessible, like Saw.
We don't know which Saw yet.
Or Flatliners,
Yeah.
or something a little less people poop into other people's faces.
Yeah, but Hortober continues.
And I just want to say,
That felt like a W too.
Yeah.
any last thoughts before
we wrap up.
we wrap this up? Dr. Greg Winter.
Thanks for having me back again.
Courtney?
And thanks for having me for the first time.
Thank you.
I think Johnny nailed it on the head, though. Don't watch this unless you're ready to watch this.
Well, welcome. I'm glad that the first time that you were on this podcast, it was for the Human Centipede. For a sequence.
But trying
Started out with
I'm still
100%
thinking about
medical
that
accuracy.
one.
Yeah.
Exactly.
We'll get you in for other ones too. But
I'll be back.
we appreciate you all listening to this episode. If you enjoyed what we did, please rate us on iTunes and also subscribe.
Yeah. And lastly, to all of the esteemed doctors that are here on this episode today, I'm just proud of us for not dropping an S-bomb.
Oh, that was tough.
Yeah.
That was real
I
tough.
swear less on this podcast than I do with my patients in real life. Without a doubt.
Yep. Follow us on
I'm not
at.
allowed to use the S word at work.
You're not supposed to. You're around babies, so you're not allowed
Everything is poop.
to poop and doo doo.
My whole life is poop. I'm
That is the
not-
best.
I'm 100% accurate. Doctor, can you look at this diaper? Look at this! Up in your face. Yep, that's poop.
That's poop.
What do you want me to do?
Yep, that's poop.
And there's the title of this episode. But if you follow us on all of our social media stuff at Hi Everybody MD.
That's correct. Thanks, folks, for listening. We'll be back next Tuesday with more Horrortober content.
Yeah, you did it.
Yay! With an H.